Medical records are some of the most sensitive kinds of information the government keeps on a person. But as two recent reports from the N.W.T Privacy Commissioner show, these records are not immune to snooping. Both cases involved N.W.T Health Authority employees opening medical records they had no business viewing. Taken together, the cases highlight vulnerabilities in the Health Authority's medical record system. And according to at least one expert, the system doesn't appear to meet the highest ethical standards for patient privacy. The CBC's Sidney Cohen has been looking into this, and she joins me now with more. So what can you tell us about these two cases, Sidney?
So the Privacy Commissioner investigates reports of deliberate unauthorized access to private health information, what we refer to as snooping. So far this year, he's reported two cases of snooping. In a case from 2021, an administrative clerk with the Health Authority deliberately and without consent opened a person's electronic medical record and relayed some of their private health information to another person. In a separate case from 2023, two Health Authority employees snooped in the medical records of a patient who wasn't in their care. The employees were siblings, and the patient had previously been in a relationship with one of them. It actually wasn't until the patient requested a record of activity on her chart that she learned about the breach. I spoke with that patient. Her name is Maurice Gravel. She said she felt incredibly violated, and she wondered why she had to request an audit herself to uncover the snooping.
Our financial institutions have the ability to flag possible fraudulent charges on our credit card or debit card. So I can't understand why a system isn't in place like that would flag accesses to patients' medical records. That shouldn't be there.
The Health Authority has to notify a patient when their privacy's been breached. Health Authority CEO Kim Riles said they're committed to notifying patients as soon as a privacy breach has been confirmed, and that they accepted all of the Privacy Commissioner's recommendations related to the snooping case.
Okay, so both of these cases involved healthcare employees. So what safeguards are in place to prevent snooping?
Right. So Health Authority employees who use the medical record system go through mandatory privacy training, and they take an oath of confidentiality. They also need a patient's name and date of birth to open their chart. On top of that, employees only have access to certain information based on their job. So for instance, a nurse will have a certain level of access, and a physician will have a different level of access to the electronic medical record system. But the system also relies on trust, that employees will only open medical records when they need to. In Maurice Gravel's case, the siblings who snooped in her chart had jobs in the healthcare system that allowed them broad access to medical records. And as Privacy Commissioner Andrew Fox noted, they abused that access.
So how does the Health Authority keep track of people who may be accessing records inappropriately?
Right. So the territory's chief health privacy officer said there are routine audits that check for suspicious activity in the medical records system, and if it's found, it's flagged to the health authority. But the privacy commissioner told CBC that verifying instances of unauthorized access is actually pretty tough.
If you looked at some random sample of employees looking at health records, there's really nothing that you could infer from the fact that a lab assistant that looked at someone's medical record or put something in there. You couldn't tell whether that was authorized or not.
In fact, neither of the snooping cases Fox published this year were flagged by a routine audit. And actually, a better system wouldn't only flag improper access, it would prevent it. That's according to Eike Kluge. He's a biomedical ethics professor at the University of Victoria. He said that if the electronic medical record system allows an employee to open medical records of a patient who is not in their care, then it's not structured according to ethics.
So what does the N.W.T's Chief Health Privacy Officer have to say about this, Sidney?
So that would be Livia Krinska-Hrdlikova. She disagreed with Kluge's assertion that the system is unethical. She said the territory's medical record system complies with territorial privacy legislation, but she acknowledged the existence of vulnerabilities.
Any system across Canada is not perfect. You see so many other snooping areas that happen in other systems as well. And always taking it the positive way, we need to learn from it. Yes, there is a harm, and of course, the people are impacted by that. But that's the way how we can learn and improve.
She also said the territory's medical record system is on track to be replaced by a new system with even stronger privacy protections.
Okay, thanks for all your work on this, Sidney.
Thank you.